A dozen children in Washington have lost their lives to COVID-19. In January, there was a death in a school-age child in Pierce County. And our hearts really go out to every family, affected by COVID-19. And so it's important to remember that really protecting those who are most vulnerable is really a collective endeavor. So masks just aren't about protecting you as an individual. It's also about what we can do as a community, what we can do as a school, what we can do as a family to protect those who are most vulnerable to severe disease from COVID-19. Thanks.
Thanks, Tal and Michelle. And I think we would all agree that we would ask parents to continue to have ongoing discussions and conversations with their children. And that is such a critical part of this, is to make sure that you stay connected, you know what's happening in the schools, and you also know what's happening with your child. And honestly, help your child through this very difficult time. This is not going to get any easier just because we're getting closer to the end of the school year. We still have several months to go, and we want to make sure that we continue to keep our kids protected. So Tal, Michelle, thank you for that. And Lacey, I think you came back off mute, so maybe you have the answer. So I'll turn it to you.
Yeah, so at-home antigen tests, typically they do have an expiration date. It's usually some number of months, maybe up to 12. You can usually find it on the back or the side of a box. On this box in particular, it's on the back. So these tests expire in July of 22. So you do need to, be mindful of that. The other thing is to store your tests in a room temperature, dry, low humidity environment, and administer them in a room temperature environment as well for best results. So check your packaging for your expiration date. And that really gets to the point of having 1 or 2 boxes on hand. In addition, while these are becoming more and more available, they still are a limited resource. So we do want to save some for our neighbors. So you don't need to go fill up a whole pantry in your house full of at-home tests. Just really have enough for your family. And as a reminder, in addition to our Say Yes COVID home test portal, the federal government has a site where you can get tests, and you can purchase these in pharmacies, and your health plan, most health plans in the US are required to cover a certain number of tests per month per member. So I believe it's 4 tests per month per member, or excuse me, 8. It's 8 tests per month per member. And so, buy them as you need them, but you do want to have a few on hand so that you don't have to go out if you're feeling ill, or, go on a goose chase to find tests when you need them. So do pay attention to the expiration date, and really just have what you need on hand.
Thanks, Lacey. So no extension of expiration date at this point. It's really about just having enough where you're planning ahead, so you have them, but you also don't have so many that you're taking away from others. Is that maybe the bottom line message? I love the visual, by the way, so thanks for grabbing those and having that. But is that in line with what you were saying?
Yes, when there are extensions that you have to, they're typically posted on the FDA's website, and you would have to go match the lot numbers. So start with your box. I would start with your box. And then if there are particular tests that there are questions about, if reporters could follow up directly with us, we can do the back end research on that.
Perfect. Thank you, Lacey. And that just dovetails into the last comment about this, which is we're obviously, we heard the president's rollout last night in the State of the Union speech about COVID-19 and the measures that the federal government will be taking moving forward. And so we're really looking for the details of that. I'm sure there are going to be additional conversations this week and the following as we have with our federal partners related to that. I know that there is a real approach to a 4-pronged look at the path ahead, protecting Americans and certainly against variants, and then doing everything we can to continue to move forward with our economy and our ways of life, but also working to help vaccinate the world. So I think there are many components that are in that, but we're just in case there are any questions about whether we have any specific comments right now, we're really waiting to learn more. I will say the test and treat option that the president mentioned last night is something that we are very interested in learning more about. And that was that if somebody tests positive at a pharmacy, that they would immediately be able to get antiviral medication. And obviously we don't have details about that, what that looks like, but that's certainly something that we are very interested in learning more about. So with that, Nikki, I think I've gone through all a bunch of questions that had come our way. So why don't we turn it over to you, Nikki, and we can go through the Q&A with any of our media partners.
Thank you to our panelists. This brings up our Q&A segment of today's briefing. First up, we have Ariel with the Spokesman Review. Ariel.
Thank you. I have two questions today. First, at what point will the pandemic become an endemic, and what markers or data are you looking for that shift? And then secondly, what is your response to immunocompromised people who feel like they are being left unprotected when the mask mandate ends this month? Thank you.
Yeah, thanks, Ariel. And I will say that this term endemic has been one that I've been careful not to use. I really. It's not that it's a bad term necessarily, but it's just that it has different meanings to different people. What really I'm focusing more on, and what we're looking at the department, is how do we look at the long term, and how do we learn to coexist where we know that COVID-19, the pandemic itself, or this virus itself, has not gone away. That it is still something we need to be thinking about, but at the same time, how do we live our lives while we also keep an eye towards or think about safety and health and protections? So, doing both are not in contradistinction to each other. You can do both. But when we look at the indicators or the measures, that's actually what we are right now in active discussion on, and what that is going to look like for us as a state, and what we believe from a public health standpoint are the most important measures. Now, remember, CDC has forwarded what they're looking at in terms of both community transmission and also what's happening in, and more that emphasis of what's happening in the healthcare system and healthcare capacity. And certainly that's something that we're very, very, obviously very, we feel are very important indicators. But at the same time, there are other indicators such as vaccination rates, and where vaccinations are more, the rates are higher versus other places where the rates are lower. So thereby you don't have the protections, as Tao had mentioned earlier when he showed the graphs. I mean, there's some things that we really do think are important that we need to continue to monitor. I think the key message for us, though, is that as we look at this longer road ahead, it's really about making sure that we're doing everything we can to continue to have the resources available as best we can, because obviously the resources will not be at that level as it's been throughout the pandemic, but the best we can to really make sure that everybody in the state of Washington who does not have access to things like PPE, masks, et cetera, or tests or vaccines, that we want to make sure that that awareness is there, and how they can actually access it is really important for us. As far as immunocompromised people, I would say that no one should feel that we are leaving anybody behind. We really do believe very strongly that that these measures that we have continued to put in place, and we have focused on since day one in terms of protecting not just health and safety, but lives, that those measures will continue. Certainly, if people want to continue to wear masks, we are going to continue to support them. We absolutely want to make sure that people are testing when it's appropriate. We also want to make sure people are vaccinated and boosted when eligible. And so those are probably the cornerstone of how we continue to protect ourselves and those those around us. And we really just want to make sure that people are thinking about others. And I think both Lacey and Michelle, as well as Tal, mentioned this, that it's not just about us, it's also about the people around us, and how do we do what we can to help protect those around us. So Tal, Michelle, Lacey, anything you want to add to any of those two comments, two questions, and then we can turn it back.
Yeah, thanks, Dr. Shaw. Yes, with regards to endemicity, yeah, as Dr. Shaw mentioned, there's really no single indicator that that defines when a disease is endemic. Endemic means that an infectious disease continues in a population without being introduced from outside that population. And so endemicity doesn't really say anything about severity of disease. So for instance, flu is an endemic virus, yet every year flu kills thousands of people. So really what defines whether COVID-19 is endemic is just time. As the months, as years go by, will COVID-19, will SARS-CoV-2 continue to be present in our communities? The other thing that I'll add to Dr. Shaw's comments about immune compromise is that it's very important for those with chronic conditions and immune compromise to stay in touch with their physicians, and if they have symptoms of possible COVID-19, to get tested, and then to discuss with your physician whether one of the available antiviral medications or monoclonal antibodies would be appropriate for you, because these medications are able to reduce the risk of hospitalization and death. And while supplies initially were quite low, they are increasing, and I hear that we do have medications in our pharmacies that haven't been used and that could be used. And so it's important for people who are immune compromised or with chronic conditions to know that that's an option for them should they fall ill with COVID-19, and to talk about it with their healthcare provider. Thanks.
Ariel, did you have a follow-up?
Nope, that's great. Thank you.
Thank you. We'll move to our next reporter, Kate with KUOW. You should be able to talk.
Yeah, thank you so much for taking the time. I appreciate it. Just wanted to ask about the role that contact tracing will play as we move forward into this next phase of the pandemic. How important do you think contact tracing will be in this next phase? And how do you think the state is doing on that front, considering that the really small percentage of people who are being contacted at this point?
Yeah, thanks, Kate, for that. And I will say a few things, then I'll turn it to Lacey and perhaps Tao if they want to add something to this. A couple of things that, first of all, that contact tracing has been an effective tool in a number of different disease activities globally and domestically. And so in particular, it has been used in other infectious diseases such as tuberculosis and other areas where it really does look like you have an ability to know someone who has been infected, the people that they have been in contact with, and in a very quickened pace able to make contact with those individuals and essentially protect others so that you interrupt transmission. So that's the concept, Kate, as I'm sure you're aware. With that in mind, though, you have to remember that contact tracing is a part of an entire system. And it starts with somebody who has a symptom or somebody's been exposed and they have a test that comes back positive. So that implies awareness and implies testing. And as I've said before, you can't trace without a case. So once you have a test that's positive, now that individual becomes a case. And that when that individual becomes a case, then we do case investigation. So we have to then interview and talk to that person to be able to really move forward with what we're trying to do to protect that individual. And because we're taking a population health perspective, it's not just that individual, but it's the population at a whole. And then on top of that, that's where contact tracing comes in. Any of the context that that individual has, and how do we move forward with making contact with those individuals. Now, the one thing that I would say about the state of Washington, and we should all be proud of, is our WA Notify, our real technology tool that we have used and utilized. So it has lessened the human interaction need, where we have somebody, and we've gotten a lot of people, especially during Omicron, that were telling us that they had gotten an alert on their phone, and that said that, look, you may have been exposed. And at that point, that individual has some information that allows them to determine what that exposure is, what their concern for risk is, and to get tested, and further, if they have symptoms, to isolate away from others. So there's a lot that goes into this, and we're really hoping that for the future that we can continue to focus on not just the human aspect of it, which is always the critical piece, but the technology aspect, which will also allow for that work to be done. So I think in the future is really contact tracing is there. But I would say that one thing that's really important as we move forward, both in case investigation and contact tracing, is we're looking at focused populations where we are very concerned about maybe either vulnerability because of some other medical condition, or outbreaks, or age, or certain settings, congregate settings. That's really an area of focus. And then certainly doing everything we can from that to be able to make sure that we are helping interrupt that transmission or furthering of that outbreak. So that's really where the focus is going to be more and more, where it's more empowerment of people so they have information on what they can do individually, while we're also focusing more on those most vulnerable and or those that are part of outbreaks. And that's really, I think, where we're going, and then using technologies along the way. So Lacey, this is an area of focus for you. So, I know you and Tal may have some additional thoughts.
I think you covered it really well, Dr. Shaw. I think the one thing I would add is for people who do test positive, you can notify people in addition to using WA Notify. So notifying your work site or your school, if you go to school, friends and family that might have been exposed, and encourage them to get tested. And of course, you can report your positive results to our hotline. And if you need support to help you isolate, or you have questions, you could call the hotline, 1-800-525-0127. Again, 1-800-525-0127. And there is language assistance available. And we will connect you to resources if you need like a food kit or care kit or other resource to help you stay home during your isolation period.
Tell anything? Yeah.
Thanks. Yeah. Yes. As folks have said, I think the focus of the public health system will really be on those individuals and settings where there's an increased risk for transmission. So settings like homeless shelters or jails or long-term care facilities. Outside of those, it becomes sort of a community responsibility and something for all of us to be thinking about. As Lacey said, if we know of a coworker or a friend who has a chronic condition or is immune compromised, and we learn that our friend might have been exposed, and it's really important to let that person know. So the emphasis for the public health system will be on those high-risk individuals and settings, but I think it's something that we as a community need to continue to embrace. Thanks.
Thank you. Kate, did you have a follow-up?
No, that's good. Thank you so much.
Okay, we have 8 minutes left and 3 reporters left in the queue. Next up is Nicole with Cairo. Nicole, you should be able to talk. Nicole, we can't hear you. Are you able to hear us?
7-day case rate, but are still being classified by the CDC as being kind of high community levels of COVID. And so is that because they have lower numbers of hospital beds, or what kind of role does the bed number also play in the CDC classification?
Yeah, Tao, did you want to take that one?
Yeah, sure, I'd be happy to. Yeah, the CDC devised this new system of community levels to try to come up with a way to give communities an early warning if increased hospitalizations or deaths are anticipated in a few weeks. And so they arrived at a combination of indicators that includes transmission in the community, as well as hospitalization rates and the percent of patients hospitalized with COVID-19. And so data from hospitals is a really important part of the new community level system. And so our team is working with CDC on clarifying their data sources, and we're working on being able to reproduce the CDC maps with our internal data that's more updated and more frequently refreshed, and hopefully that will be helpful to communities to measure their risk.
Elise, did you have a follow-up?
Yes, thank you so much, Dr. Kwonget. That's helpful. And so does that mean that for some counties, if they have a lower number of hospital beds, that they could remain in that red state classified by the CDC, even if actual infection and community transmission rates are low?
Yeah, that's a good point. And the way the CDC assigns a hospitalization rate to a county is they take a look at the hospitals that serve that county. And so that could be a hospital in another county or maybe even another state. And they look at the health service area serviced by each hospital, and then allocate a certain fraction of cases to the counties and states that are served within that health services area. So, so even though a county may have a few hospitals or no hospitals, still hospitalization data is still used